Welcome to Park Avenue Plastic Surgery Class, a podcast where we explore controversies and breaking issues in plastic surgery. I'm your co-host, Doreen Wu, a clinical assistant at Bass Plastic Surgery in New York City. I'm excited to be here with Dr. Lawrence Bass, Park Avenue plastic surgeon, educator, and technology innovator. The title of today's episode is Sweet Dreams, Comfortable and Safe Anesthesia. Dr. Bass, as we've said many times on the podcast, we all want to be beautiful, but some of us are afraid of the experience or the risks involved with having plastic surgery. What would you say to those of us in that category?
Everyone would like to achieve the results they're after in the least invasive way possible, ideally without surgery. And there's been a revolution in the past 3 decades in aesthetic medicine and plastic surgery with many non-surgical offerings which are extremely valuable. However, plastic surgery is still often the only meaningful option, depending on what stage of aging you're at or which beauty feature is involved. Fortunately, there's been a revolution in how and where aesthetic plastic surgery is performed over those same past few decades. Some of this is fueled by the advent of minimally invasive procedures, and the evolution of open surgery has been refined and focused. Almost all aesthetic plastic surgery procedures in almost all patients can be performed in an office operating room, which, in compliance with accreditation standards for such facilities, provides a very safe, private, and comfortable setting to obtain your plastic surgery. Safety and comfort are the key. Much of what has enabled this shift to office surgery relates to improvements in anesthesia. This follows the same pattern as what has happened with non-aesthetic surgery in the United States, with a shift of a large percentage of all procedures to an ambulatory setting without a hospital stay.
Going under anesthesia is a source of concern to many, as much as the surgery itself. How much should I worry?
As I said, modern anesthesia has made tremendous advancements. I've asked one of the senior anesthesiologists from the group that works with my practice to discuss some of these issues. Dr. Kalman Friedman is a senior anesthesiologist with the Caliber Anesthesia group. As I said, they provide anesthesia services in my practice and for many other esteemed plastic surgeons up and down Park Avenue in New York City. He also has a great deal of experience in running and managing ambulatory surgery centers and all of the demands of ambulatory anesthesia in distinction from hospital surgery. Welcome, Dr. Friedman.
Thank you. It's a pleasure and an honor to join Dr. Bass on this podcast.
So, Dr. Friedman, can you tell us what kinds of anesthesia are typically options for office-based plastic surgery?
So most office-based plastic surgery is done under either general anesthesia or IV sedation or MAC, what some may call twilight. IV sedation kind of runs on a continuum. At one end, it could be just a bit of medication to relax you while the numbing medicine is injected. To the other end, deeply asleep, or anything in between tailored to the situation.
And how risky is that really? How worried should I be?
It's very normal for a patient to be apprehensive regarding having anesthesia. However, nowadays, with advances in medications, our scientific knowledge, and our monitoring devices, anesthesia is very, very safe. Of course, there is always some degree of risk one must accept in undergoing any procedure, but it is extremely minimal. The risk of having any anesthetic-related problem, let alone a serious problem, is very, very low. One of my mentors used to tell all of his patients that it is safer to go under general anesthesia than it is to cross the street. Not the way we usually look at things, but it is certainly true.
And I think that that's absolutely right. The anesthesia capabilities in terms of monitoring and keeping an eye on patients' vital signs, oxygenation, is a totally different place than where it was a few decades back. That greatly amplifies safety, and many of the medications are short-acting without the anesthesia hangover that was true 40, 50 years ago. That allows people to wake up quickly, feel well, and be ready to go home. Well, let me ask you this, Dr. Friedman. A lot of patients feel that general anesthesia has more risk than IV sedation. Is that true? I mean, why do patients think that, and what are the issues?
That's a great question. It is probably the most common question I get from patients and find myself discussing this with patients. So I'll spend a few extra minutes on this question. I'll start off by saying that both general anesthesia and IV sedation are both very safe. There are some surgeries where one is more appropriate than the other. Often, either can be done, and it is a discussion between the surgeon, the anesthesiologist, and the patient to find the best fit. I do want to clarify that with both general anesthesia and IV sedation, the patient is asleep and safe. The real big difference is in the level or depth of anesthesia, and that is usually dictated by the nature of the surgery. I think what you are referring to, Dr. Bass, is the breathing tube or being intubated. What comes to mind for some people is a patient on a ventilator in the ICU, where they imagine someone putting a breathing tube down their throat while they are in. In reality, most of the time we perform a general anesthetic with a soft rubber airway device called the LMA that sits in the back of the tongue, and the patients breathe on their own through this device. It is placed when the patient is asleep and is removed before the patient wakes up. In reality, most consider general anesthesia as safer given that the airway is secured with the LMA or a similar such device.
And I think that's a really important point, that often general anesthesia is going to be a more even level of oxygen intake, a more even level of blood pressure than something that's done under local anesthesia or with the barest minimum of sedation. So in that sense, it's less physiological stress and really a safer experience overall. And the other point you made that I thought was really important is that the magnitude of the surgery often dictates what level of anesthesia is required for someone to be completely comfortable while the procedure is going on. So that kind of drives the situation to some extent in terms of anesthesia selection, and it's important for patients to realize that.
But Dr. Bass, can I just have my procedure under local anesthesia? As the surgeon, what do you think about having more anesthesia versus just having local? What's your take on this?
As I said, a lot of it has to do with the extent of the procedure. If you're having a skin biopsy or an earlobe repair, the local anesthesia works perfectly well. You're very comfortable. It's easy to do. The procedure is short. And so it's easy to sit still for a few minutes while the procedure is completed. But as the procedure gets larger in magnitude, the length of the procedure becomes longer. It gets harder to manage that just under local in a way that's really comfortable for people. And so having a comfortable experience and gauging the amount of anxiety that you have as an individual is important in deciding what kind of anesthesia is really going to be right for you. Some people are a lot more anxious than others. Some people just seeing the operating room, hearing the monitors beeping really gives them a lot of anxiety, or in some cases, a panic attack. In those circumstances, enough anesthesia to be relaxed, comfortable, or even asleep and dozing is going to be more appropriate so you can get through the procedure and it's not an ordeal for you to go through. The other thing is, when the anesthesiologist is present in the operating room, it allows the surgeon to focus just on the surgery, concentrate on giving you the most precision, the most artistry, the most perfect result that's possible. rather than having to split attention between the procedure, your vital signs, and your state of mind and level of comfort. Having excellent anesthesia allows for very extensive interventions. It allows you to push the procedure to the maximum. Perfect example of this is liposuction. A lot of liposuction is done just with tumescent anesthesia, essentially local anesthesia. And for small liposuction, that works well in some cases. But if you're trying to treat 2 or 3 areas, or you're really trying to bring things down to the barest minimum of fat, that's a lot more stimulating and uncomfortable, and you may succeed better at achieving your goals if the procedure is done under anesthesia. And it lets you do multiple procedures at once. And having another physician there who's an expert in cardiac and pulmonary physiology and understands how to monitor and manage that makes you safer. It reduces the split attention of the rest of the staff in the room. So I think those are some of the reasons why, as the procedure becomes substantial in magnitude, anesthesia is really the right way to go.
I think Dr. Bass covered all the points. Of course, for certain minor procedures that can be numbed up completely and the cooperative patient, it can be done safely and comfortably with just local anesthesia. I'll just add that I hear from colleagues of mine at other practices that they tend to do procedures that should have an anesthesiologist. And for one reason or another, they decide to do it with just local anesthetic. They run into all the issues that Dr. Bass mentioned. The surgeon is preoccupied with an uncomfortable and often swarming around the patient. There are also practices that will heavily sedate the patients themselves under the disguise of a local anesthetic without an anesthesiologist. Clearly not a good and safe idea.
And an important thing about that is that, it varies in each individual state, but in New York State, where Dr. Friedman and I practice, there are very specific rules about what procedures can be done in just an office operating room and what has to be done in an accredited office operating room, and how much sedation can be given if it's not given by an anesthesiologist or other qualified anesthesia provider. So the idea of taking an awful lot of oral medicine, which has variable absorption, really is not a safe approach. And if the procedure is of a sufficient magnitude to require that, it's better to have the quality and control of having an anesthesiologist who can make sure that you're safe and comfortable.
Now, let's look on the flip side. What are the disadvantages of having more anesthesia?
So, of course, there's a cost to everything. So if you're bringing an anesthesia provider, the anesthesiologist adds a cost. Medical clearance will be required over a certain age. And people who have had anesthesia need to go home with an escort. Again, in our state, New York State, that's mandatory. And of course, there's a little bit of time to recover from the anesthesia. For minor procedures or a small single intervention, those may be unnecessary added impediments. But if you start to get to a more extensive procedure, even if you do it under local, you're not going to be good to drive yourself home. You're going to need an escort. You may need medical clearance if you're older or have medical conditions just for the surgery to be performed safely. So you're not necessarily foregoing all of those disadvantages just because you're doing it under local.
Okay, so now, Dr. Friedman, I want to pick your brain for a moment. I wonder, what do you feel are the advantages of care in the office setting and with the kind of ambulatory anesthesia that is available today?
I just want to start off saying that today, the majority of all surgeries are done in an ambulatory setting. I am not just talking about elective cosmetic surgeries that we're discussing, but your hernia repairs, tonsillectomies, knee and shoulder repairs are all mostly done in the ambulatory setting. The advantages are manifold. I'll start off with safety. The risk of acquiring infections is lower. Medical error is reduced. The surgeon has what we'll call home court advantage, having his hand-picked instruments, nursing staff, anesthesiologist. From that anesthetic end, ambulatory anesthesia has become a specialty on its own, meaning that your anesthesiologist who will be taking care of you in the office setting has been trained and has experience in this. We have the same medications, supplies, and equipment available as in the hospital and are trained to deal with any situation that can arise. And of course, you have the convenience factor. Anyone who has had to deal with hospital bureaucracy knows this all too well. Your surgery starts on time and not delayed many hours into the afternoon while you are still NPO, not eating or drinking for the morning. The patient's responsibility per facility costs are usually much lower in the ambulatory setting as well. You will also know beforehand who your anesthesiologist will be, and he or her will call you before and go through your medical history and will discuss the anesthetic options and plan it. At this time, you would also have the opportunity to ask any questions and then discuss any particular concerns that you may have.
Finally, before we conclude, Dr. Bass, what should our listeners take away from today's episode?
So I think there are a number of important points that I could summarize. As you heard, anesthesia is very safe. There's a small risk, not zero, because there's not zero risk in anything we do in life. And it's very much like driving a car. Every time you get in the car and drive somewhere, something terrible could happen. You could get in an accident, but the chance is very low. So you don't hide at home in a dark corner. You get in the car and drive, but you look both ways before you pass into an intersection. You follow the rules of the road and drive cautiously. And even though the risk isn't zero, you're very safe and you get a lot of benefit from the mobility of being able to drive. Having anesthesia allows the procedure to be very controlled. It's an added layer of safety overall for patients. And working in an office-based surgical facility is private, it's cost-effective, comfortable, it's very efficient. As Dr. Friedman just pointed out, it's the whole team that's all optimized and used to working together. Dr. Friedman knows what I'm going to do. I know what he's going to do. We've worked together many, many times. It's not whoever the hospital sends in that day with a brand new team almost every day in the facility. And so overall, this makes an office plastic surgery the safest, most comfortable, and pleasant experience possible for aesthetic plastic surgery. The plastic surgery experience is about service, comfort, privacy, and getting the chance to enjoy making your self-image according to your desires. It's a boutique premier experience, the best in quality and with safety most important. The kind of anesthesiologists who work in the office-based plastic surgery setting are committed to all of the principles I just listed. Anesthesia advances have been central to enabling that entire experience, even for extensive plastic surgery. And it allows patients to be asleep, totally comfortable during even extensive procedures, then wake up rapidly, be alert enough and comfortable enough to walk out of the office, able to eat and drink and recover in the comfort and privacy of their own homes.
Dr. Friedman, would you like to add any takeaways?
That was a great discussion we had today and hopefully informative to the audience. Remember that your anesthesiologist is there to keep you safe and comfortable. Consider him your primary care doctor for the day and always discuss with him or her all of your medical conditions and any questions or concerns you have, and you'll have a great experience.
Thank you, Dr. Friedman and Dr. Bass, for sharing your insight and expertise on this very important topic in plastic surgery.
Thank you, Dr. Bass, for having me on as a guest. And thank you, Doreen, for hosting this discussion.
And thank you, Dr. Friedman, for joining us and sharing so much useful information. And thank you for providing such excellent care, along with the rest of your team, to my patients. I really appreciate it.
Thank you for listening to the Park Avenue Plastic Surgery Class podcast. Follow us on Apple Podcasts, write a review, and share the show with your friends. Be sure to join us next time to avoid missing all the great content that's coming your way. If you want to contact us with comments or questions, we'd love to hear from you. Send us an email at podcast@drbass.net or DM us on Instagram @drbassnyc.